I'm Dr. Kanak Tyagi. I'm associated with Preet Vihar for Cataract Services and Pediatric Ophthalmology. Pre-surgery, we always evaluate from checking your all interior segment, the posterior segment, the fundus, the retina. And once we are done with that, then we'll go for which IOL power, which kind of IOL power is suited. And then we go for all OCT tests. These are nowadays mandatory because without evaluating completely, we are not in a position to give you the good advice that which kind of IOL or which surgery would be suitable for you. So we evaluate completely. Once the surgery is done, then post-op, 1 week is required for the recovery period, mainly 1 week, because most of the patients they ask, can we go for our work after 3 days? I would just say, yes, you can do your routine work from home is possible after 3 days, but going in outdoor activities, I would suggest that wait for a week and then go for your normal duties outdoor. Most of the patients, they come with the misconception or myths that I've been told that it's too early, cataract is too early. But when we examine their eye, it was basically having a very high refractive error, plus or minus, with a minor lens changes. But that doesn't say that you are not suitable for the surgery. According to our examination, you are suitable for the surgery because your refractive power is also very high. Initially, the cataract was a concept when the lens opacified, then only you need to remove. Now the concept is, even if you have a high refractive error with the early changes, we can remove your lens and you can make you glasses free. So that's the latest concept of cataract surgery. So I would say don't wait for all these things, so that if you're regularly having a change of power, you're having a difficulty in near vision, you're having glare, go for cataract surgery. You shouldn't wait for the late stages and then get the surgery done. बहुत सारे पेशेंट ऐसे होते हैं जिनको डायबिटीज़ होता है, प्रोस्टेट का प्रॉब्लम होता है, कार्डियक प्रॉब्लम होता है, उनकी पुतली नहीं फैलती है, सिस्टमिक इश्यूज होता है, पोस्ट कैंसर पेशेंट होते हैं. तो इन सब पेशेंट्स में कई बार ऐसा होता है कि सर्जरी करना नॉट बिकॉज ऑफ द कैटरेक्ट इज कॉम्प्लिकेटेड, इट इज़ योर सिस्टमिक कंडीशन विच इज़ नॉट अलाउिंग अस टू डू द कैटरेक्ट वेरी ईजिली because the pupil is not dilating or there are some other issues, your retina is not healthy, we don't get the good glow while doing the surgery. So in all these cases, we say that we have to take a different approach, and the patients are like, they always compare X with Y, which I say, no, X is X and Y is Y. You are supposed to get your surgery done according to your eye condition and your systemic condition. And you shouldn't compare yourself with anybody if you are having multiple systemic issues because your pupil is not dilating. And while doing the surgery, when you are on prostate medicine, there are few issues which we handle during the surgery. So don't compare yourself in anybody. According to your systemic condition, go for the surgical option, what doctor has suggested you.
Follow Center for Sight and post your queries to get answers from the experts.